Ms. Winters, you may proceed.
Okay, you can hear me and everything. All right, here we go. I'm prepared this time because with HHSC, it didn't go well. My name is Deborah Winters. For 13 years, I fought for my son Taylor, who struggled with serious mental illness. For 13 years, we dealt with trying to access the right care at the right time at the right place. After 13 years of multiple hospitalizations, multiple arrests, multiple placements on the forensic wait list, my 32-year-old son died on November 2nd in Kaufman County Jail within 6 days of being arrested during yet another psychiatric crisis. He was found alone in solitary confinement by medical officers. From the first moment he was arrested for the ninth time, I began making phone calls. I called the crisis hotline with Andrew Centers, who was the LMHA that he was being attended to by at during that time. The LMHA caseworker that he had got a list of his medications to them by that Friday. He was arrested on Thursday. I also called everybody I could think of from police department to the county jail to the Kaufman County LMHA to the Texas Jail Commission, Texas Commission on Jail Standards. My son died due to lack of continuity of care. Despite all of the policies in place to ensure continuity care, not one person in the system intervened in a timely manner. The jail had his entire medication list. The LMHA knew that he was in the jail and being held in solitary confinement. Despite every system actor being aware of his mental health and incarceration history, they all failed him. I implore this council to urgently deal with the criminalization of our vulnerable loved ones, to fix the continuity care between the LMHAs and the jails. This year, 136 people have reportedly died in our county jails in Texas. How many of them were like my son Taylor? Enough is enough. This has to stop now. And I understand the trying to get the jail based competency, but let's teach our jailers about mental illness first. Let's get them to identify people who have SMI. Let's get them to see, because they would not believe me. They didn't believe that he was sick. They didn't get medication to him, and that's unacceptable. This needs to happen now. We are losing too many people in jails for no reason. Thank you.
Thank you. Kayla, before we move on to the next person who has public comment, I want to acknowledge the comments that Dr. Pignon made and Ms. Winters that you have made, and take the time to acknowledge the death of your son, which
Thank
is
you.
a horrible loss. I'm a mother of twin 3-year-olds, and I cannot imagine what it must feel like to lose a child, particularly when your child is hitting systems that are designed to help them and to truly be a safety net. And there were clearly missed opportunities to act. I heard in your testimony, Dr. Pignon, as well as from you, Ms. Winters, that there are issues with continuity of care, right? How people transition between systems, particularly once people hit a county jail, and what their interaction with behavioral health providers looks like while they're in the jail, but then also a transition. Both of you, to me, sound like parents who are aware of resources, but the resources that you've connected your children to either weren't suitable to meet their need or were suitable, but still the need wasn't met. And then what I heard from Dr. Pignon is, in as much as possible, right? Like, you want to keep people out of a system like the DFPS system, or Department of Family and Protective Services, certainly want to keep people out of county jails. And you spoke about the need for services that keep people from hitting those systems. We should not be criminalizing behavioral health conditions or people with those conditions. So I wanted to take the time to acknowledge that we hear your story, and so much of what you were bringing forth to us today.
With the 3 minutes, there was a lot left out. So,
Yeah.
and that shocks me, because we're the people that have the stories that you guys need to know about, but we're not allowed to tell them. We have 3 minutes, and almost, I had to shrink it down by half, more than half, just to get the important stuff in there. My son was having a psychotic break, and the jailers treated him like he was a criminal. And that I told them, if he did not receive his medicine, he would have a seizure, a possible heart attack, or a stroke. And then I said he would get worse. And I said, what are you going to do if his behavior comes worse? Well, we'll put him in isolation. I said, if you put him in isolation, he could have a seizure and hurt himself. Well, we'll put him in observation. Well, obviously he wasn't in observation. He had massive brain damage.
Yes.
From a seizure.
I want to, Ms. Winters, follow up with you. I know, to your point, everybody has 3 minutes to provide public comment, and that often isn't enough time for you to tell your story. Some of you, I know, in addition to providing public comment, are also going to provide written comment. So we'll be following up with you afterwards, because I know that 3-minute time frame is very truncated. So thank you so much for sharing your story with us, but there will be follow-up. I will be following up with you.
I appreciate the condolences, because the last meeting they didn't even offer condolences for the loss, and it was 8 days after he passed. So I appreciate that. Thank you.
Thank you.